I'd just like to welcome Dr. Dilis Clare, who's here with us today for World AIDS Day. Dr. Clare is a trained medical doctor and a general practitioner. She is also trained in herbal medicine. Dr. Clare has a clinic here in Galway, in Sea Road, opposite Ernie's, down by the Jazz School. Her clinic there works in collaborative medicine, so you'll get the best of both worlds, medical health and herbal and complementary medicine in the same location. Dr. Clare is going to talk to us today about how people living with a chronic health condition like HIV can use diet, nutrition and herbs to increase their immunity and resilience. So thank you very much for being with us today.
Hello, good morning, Nicole.
Good morning.
Good morning to everybody out there, and happy AIDS Day. Great to have a celebration as to how well everybody is doing and thriving, I hope. So I'm helping to do that more in the future.
That's great. Thanks so much for being here today and spending some time with us to talk about this. So the first thing I'd really like to ask you is, as we know, people who live with HIV can now live long and healthy, happy lives. I wonder if you would let us know what you would consider the top 3 nutritional and herbal ways that people who live with HIV and who are on HIV medications could stay healthy.
Okay. We have a very short time, so I'm going to be very, very deliberate and very succinct. So pay attention. Vitamin D. Anytime the sun shines, get out, take your clothes off. Not on World's Day, AIDS Day. But you want sunshine all over your body. So that's if you get your bikini out, during the winter, take a vitamin D supplement. I can't give direct evidence, particularly for HIV, but for everything to do with the immune system and to do with the brain being a steroid related, all of the nervous transmitters, all of these things need vitamin D. So I'm just extrapolating from the bleeding obvious, right? Vitamin D. Essential fatty acids, oily fish, 3 times a week. Nuts and seeds, 2 or 3 teaspoons, 3 times a week. I didn't say 2 or 3 bags 3 times a week, because they can be very moreish. 2 or 3 teaspoons 3 times a week. So nuts and seeds, oily fish, and avocados. Okay, 2 or 3 avocados a week. Buy them a week ahead and ripen them in your fruit bowl with your bananas. Put them in a brown bag, and it helps them soften up. And the herbs that I would mention, particularly for your food. Oh, the last thing on the food is the 7 to 9 veg and fruit every day. Can't get enough of them, okay? Particularly the veg that grow over the ground. So in other words, not too many potatoes, carrots, parsnips, but definitely include them, especially in the winter. They are hearty foods. They're heartwarming foods. And our food should be minding our bodies and our spirits. So you want to be warm and comfortable, and that's all the vegetables for you. But also lots of green vegetables for folic acid and all the other vitamins. So 7 to 9 vegetables and fruit per day. Essential fatty acids and vitamin D. Okay, so that's that. Sorry, I don't mean to be stabbing at you, but very important. So include in that all the garlic, onions, leeks, chives, all of that family. Very, very good for both for living with any chronic viral illness with antiviral properties, but also very good for protecting the lungs, and particularly in times of COVID. So all of those really earn their keep. Turmeric is a specific anti-inflammatory, good for pain, good for anti-cancer, all of the things that having a chronic virus puts a strain on the body. So you don't want to only eliminate the viral load, you also want to program all of your best anti-cancer metabolism, right? So you're looking wider than just a virus. It's not just a virus. We're all unique people. And we have other family histories and genetics and complaints and all the rest of it. So turmeric is very good, particularly, for instance, if you've got arthritis. Instead of using non-steroidal anti-inflammatories, the turmeric would be very good. So herbs are very good, not only for having a chronic virus, but also for treating your acne or irritable bowel syndrome, because people who are HIV positive also have all of these things, and the herbal medicines can be very useful for dealing with them. Calendula has been shown to have some antiviral activity, but it's also healing, antifungal, which can be a problem for people. So that herb in particular is very good. Green tea. You know, have two cups of green tea a day. Put some honey in it. Nicole is from New Zealand, so we'll put in a little bit of Manuka honey in there. It doesn't have to be that. If you were to have a choice between the two, it would be local honey as well, particularly around thyme plants. And then add in sage and thyme, because they're antimicrobial. And they help to keep your gut microflora healthy. So sage and thyme. I can say, if you get a cough, use hyssop. Make yourself a hyssop syrup, or you can use in fact the Kinder kind one, which has hyssop in it, because that's very good for a cold, and also thyme. You can make a very easy onion, thyme, and hyssop syrup based on YouTube. You know, so I love it when people do their own medicines. That's absolutely fantastic. I've no problem with people with HIV using echinacea. And echinacea is good for priming and supporting and modulating. It's not a stimulant, it's not a suppressant, it's a modulator. So it helps your immune system be fit. It's like sending it to the gym so that it's prepared, okay? Going to the gym is a very good idea as well. You can make your own gym at home, lifting any kinds of things and doing all the exercise, very good. So echinacea is very good. So I'll put them in a list for you: garlic, turmeric, marigold, green tea, sage, thyme, and echinacea, and hyssop. Work away, no problems with all of those. Even when you're on the regime, whatever regime of medication people are on. And astragalus. Astragalus is another herb that we use for the immune system. But I really would suggest that you see a medical herbalist to fine tune things like andrographis. Echinacea I'm perfectly happy with. But if you want to use herbal medicine for any other condition, as well as being HIV positive, down at the clinic, I work with another herbalist who also has a degree in herbal medicine. We're all genned up on the pharma. We know what we're doing. So if you want any advice about other medication or using herbs, feel free to make an appointment and come and see us. I've said, did I say the word heartfulness? All of this is about loving yourself, taking the time to love yourself. I'll give you an example. I'm up in an upstairs room. It's not, I don't usually use it during the day. It was cold. I went and I got a heater and I turned it on. These are the small things. Epsom salts in your bath once a week. These are the small things. Very, very important. Actually, in preparing for today, I did actually find a research article which showed that self-care and I'm saying self-love. They don't write those kinds of words in medical articles. They don't believe in those things. I do. Sometimes any of these chronic illnesses can be a heavy load to bear. So loving yourself is a very good place to start. Approving of yourself is a very good place to start. Being kind to yourself. So self-care, and this can be down to, yes, I will bother to brush my teeth before I go to bed, even though I'm fed up and it's been a bad day. This is about leaving that little 2% at the end of the day for minding yourself. I would always strongly encourage people to use natural products. They're not more expensive. We all use far too much of them. So what you do is you buy natural products. They're in Aldi, they're in Dunn's, they're in everywhere now. So you just have to look for them, and then use them very sparingly. We all use 5 times as much toothpaste as we need. We all use far too much squeezy things in the shower. Get a bar of soap; it's much cheaper, and get yourself a nice bar of soap. So that's how to make it work for you. Things like rose water, rose petals, lavender petals. All of these things, a bowl of lavender petals beside your bed, throw some rose petals in your bath. We have all of those down in the clinic, and they're very nice for making little sachets for people for Christmas presents, given that we're all at home, and just cut up an old t-shirt or a shirt that's gone past its days and reuse things. I'm terrible. I think thrift should come back into fashion. I think thrift should get sexy. Okay, so daily self-care is, and I want to thank you all for, I got up this morning and put my makeup on. I can't remember the last time I put my makeup on, so I should enjoy it all day. That's the last thing on the list, but it's lovely to have reasons to celebrate, and to celebrate ourselves on a daily basis, which is part of self-care. In the meantime, it's all about the love and safe sex, of course.
And I really appreciate talking about the self-love and self-care as well. I think that's something that in these times when a lot of us are anxious and worried and hearing a lot of negative stories about health issues in the news, that really helps us return to our bodies and return to being here now, is just to care for ourselves as well as we can.
People who have HIV positive status, I go back to the 80s, and I was living in London as a lesbian, and I went to so many gay funerals, funerals of gay men with HIV. We are so lucky, and to have a condition like that, and be able to survive and thrive is just amazing. It is amazing. And this is why I practice collaborative medicine. There is so much to offer, and we are so fortunate. And each day is a gift, and living with such a condition, at some stage, you have to have faced that reality. And I think the other thing that's very important for living on an ongoing basis is to avoid secrets. Secrets are not good for the soul. Okay, but finding the balance between not having secrets and trust that's the Goldilocks moment. But look for it wherever possible. And speaking as somebody who has always lived outside the box, the number of positive things that has brought, compared to the very few negative things, people would hardly believe it. Everything from sending my kids to school to colleagues at work. Throughout all of my career, I have been out as a lesbian. I've had friends and indeed exes who were secretive from their families, and it's not good. And this was before the referendum. This was 30 years before the referendum. So people are too busy with their own concerns to be worried about yours. And if there's people who are judging you based on something that's happening in your life and that you're dealing with, and it's a reflection of their own inner problems. It's nothing to do with how valuable you are, or how much love or life you deserve.
Yes, well, that's a really important point, because these things we hold on to in our minds and our mental health does have a strong influence of our well-being and our bodies as well. Certainly, I mean, you would know that very well with the work you do, that there's such a strong connection. And certainly disclosing something, especially for people who are living with HIV, is a very can be for many people complicated and can be very rewarding as well.
Yeah.
So thank you. And if people want to follow up with you, that's your...
Oh, we put loads of stuff up on Facebook, Instagram, about how to find herbs in your neighborhood, about some of the different products that we have, including things like rose water and witch hazel that are hard to find, you know, because they're so natural and they're so inexpensive. So, so Facebook, our website, which is Dr. Clare Apothecary, that's what both of them are. And yeah, give us a ring if we can help. And if there's something you can't find on the website, don't hesitate to give us a ring. So we're here. We've been here for 21 years this year. We've just had our 21st anniversary. Okay, take care. Bye.
Thank you very much.
Bye-bye.
Bye-bye.